So the last airway is a trach. And a trach is going to be on a stoma on the outside of the body, and it's going to go directly into the lungs. On an adult person, adult type person, they're going to have a cuffed trach. And a cuffed trach, again, is simply going to hold this tracheostomy in place. It's going to hold it right there. We're going to assess the balloon at least once a shift. For a neonate or a pediatric type person, the trach is not cuffed because we don't want any damage or pressure to that precious little delicate trachea. So that's going to be an uncuffed trach, but you have to make sure that it is securely in place every time because that little baby is going to be wanting to put their hands up and, you know, they just grab stuff and pull it. So that would be the last airway. Now, a person can live with a tracheostomy on room air for however long. Maybe they've got some difficulty. Maybe they've got a tumor up here that they're not able to oxygenate. If they do need supplemental oxygen, we would generally put them on a trach collar. And that trach collar should be humidified because they don't have the benefit of the nares and the sinuses to warm and humidify the air. And if we're supplementing 6 or 8 liters of oxygen, we're going to be drying all this out and putting them at risk for infection because their mucous membranes aren't able to do what they should be doing. So those are a couple things that you want to think about. If they're on a trach collar, then they need a bubble bottle. If they have an endotracheal tube, they probably don't need a bubble bottle because the ventilator itself will be humidified. There'll be a filter, an inline filter that will provide humidification for that patient. And those get changed every 24 to 48 hours depending on hospital protocol. When we suction tracheostomies and endotracheal tubes, we can do it with 2 methods, open or closed. Open method is more for a tracheostomy, or if we do it with an endotracheal tube, it's just an emergency type thing, something that's acute. We would use a closed system as much as possible because a closed system provides sterility, where an open system, there is much risk for contamination.